Hey guys, what's up? Joe here with my video all about why I'm passionate about staying active and being active. I want to put a bit of a content warning out there that I will be talking a little bit about diet, food, weight loss, and some of my own struggles with my health, particularly around my condition, which is an inflammatory bowel condition. So now I've said all of that, let's get into it. So personally for me, being active is one of the best joys in life. And I think the body is the best tool that we have that we can always look after and we can always do something for. And I don't think people really appreciate how good we have it until we don't have it, right? And I think this is a common problem in a lot of things that we do in life, but particularly when it comes to our body. We as society has moved forward, we now spend a lot of time being very sedentary, sat at a desk, sat on a sofa in front of a screen. But we spend a lot of time sitting and doing things in a very sedentary way. And although it's okay to take rest at times, this sedentary lifestyle is actually not very good for us in the long run. When I was at university, part of the course that I did was sport and exercise science. And one of the really interesting modules that I did on this was a module called exercise and medicine. And this actually looked at all the benefits that you can get from just being more physically active, but also the detrimental effect that a sedentary lifestyle has as well. So things like the fact that being physically active can help reduce a lot of common health conditions such as heart conditions, kidney problems, diabetes, risk of cancer. All of these things can be reduced through being more physically active. Because if you're sedentary for prolonged periods of time, it massively increases your risk of all those health problems as well. So being active has that as one benefit, but the other benefit as well is the mental benefits that people can get from being active. And that's, again, there's a lot of research out there that's showing that people who are physically active struggle less with things like anxiety, depression, um, struggle less with things like motivation. And a lot of the time, it's kind of getting over that hurdle to be active in order to then be able to get those benefits is where people tend to struggle more. And I'll probably talk about that in a future video as to how some of the tricks that maybe people can use in order to try and overcome some of those barriers in the first place. But I want to talk to you a little bit about why being active for me personally has been such an important part of my life. I'm 30 years old now, and as I said, even from a very young kid, even from sort of 5 years old, I can remember always enjoying running around, playing tennis, going swimming, even playing a little bit of football with my mates. I always used to love just going and doing something. And I've tried a lot of different sports and a lot of different activities over the years because I love that feeling of challenging myself, and I love that feeling of trying something new and learning a new skill for the first time, or developing a skill that I've maybe had a go at before. I've done, a lot of different sports over the years, and I've tried a lot of these different, what we might call hobbies, but they're all active things. And I think just that in itself has brought me so much joy, but also the health benefits that I've had from that. Now, I I consider myself what would maybe be kind of a fairly healthy person in terms of, now I eat fairly clean. Not, I don't restrict myself, but now I do eat a fairly well balanced diet. And as I said, I try and do a lot of exercise and I try and do a lot of activity. But when I was younger, kind of when I was talking much younger, sort of around that kind of 5, 6, 7 years old mark, I was diagnosed asthmatic. I used to have issues with kind of my stomach and those sorts of things as well. As I went into my teen years, I would probably class, I never got officially diagnosed with it, but I would class that I had sort of somewhat of an eating disorder. I used to struggle with, eating food particularly quickly. I used to almost have this like feeling of pressure around eating, and I was a particularly picky eater as a kid, and I think that kind of then developed into my teen years, and and then recently, as I've gotten older, I in the last couple of years have been diagnosed with a chronic health condition, which is known as ulcerative colitis, which is a form of inflammatory bowel condition. And if anyone is interested to know more about it, I'll make sure to drop a link in the comment below. And if anyone is struggling with this condition, again, please do check out that link. But what I've noticed is that through all of these kind of difficulties that I've had, being more active and doing more exercise is something which kind of almost helps to counteract some of that. Say, for example, take when I was kind of 15, 16, that was probably the height of when my eating disorder was at its worst. And when I was 16 years old is when I first started going to the gym. So I would work out like once a week, twice a week, doing very basic lifts. I was doing, kind of some sort of push movement, some sort of pull movement, and kind of two leg exercises, one that kind of hinged around the hips and one which was like a squat based movement. That was kind of, and maybe some core, and that was kind of it. I was doing a little bit more running, and I said I was playing a bit more tennis, but just doing that kind of extra little bit in the gym and kind of doing that extra activity meant that naturally my appetite went up. I was trying to build muscle at the time, so then I was trying to eat more protein, and it kind of shifted the focus away from, well, I have to just eat, to, well, now I want to eat because I'm hungry, and also I want to eat so I can continue to perform at a higher level when I'm going to the gym and help try and build this muscle and everything else. So that's kind of then one way in which it helped me as a kid. But then as I've then grown up, and when I had my first kind of big flare up of my chronic health condition, which happened just over 2 years ago, um, I was in Canada and I was out doing my skiing instructor's qualification. And then whilst I was out there, I was getting really bad symptoms. So in the space of about 2 months, I lost somewhere around 12 kilos, maybe a little bit more than that. So I was then very, very underweight. And once I'd kind of come back to the UK, I'd got my kind of assessment done and everything else, and I got my diagnosis. One of my big focuses was, well, I want to start exercising again and being more active to help build my body back to what it was. And I think before going away to Canada, I kind of dropped off a little bit in how active I was and how much activity I'd been doing, just because there was a lot of stress going on at that point. But then when I came back, I really focused on just doing like a little and often. So I would do, 5, 6 times a week, but I would do kind of 10 to maybe 20-minute sessions. And a lot of it was just around mobility, moving my body. I was doing a lot of maybe sort of doing like sort of some push-up work. I was doing some squats work, but there's a lot of mobility and that kind of things. And then as I kind of started getting stronger, I started introducing more weights back into my workouts. Again, I started introducing more kind of calisthenics workouts because I was traveling at the time. So it was all body weight stuff for a while. Again, just moving my body, kind of reconnecting with it after I'd had this big blip in my illness. And since that point, okay, now it's been very well controlled medication. But since that point, I'm now back to a very good fitness level. And I am always trying to keep myself fit so that if I ever do have a big flare up again, I'm fit enough for my body to be able to withstand potentially going through that again. And again, hopefully I can bounce back quicker if it does happen again. Now, obviously, not everyone is in that situation, and some people are in much worse off situations than me when it comes to these sorts of things, but some people are in much better situations. But ultimately, I think the key message that I'm trying to get across here is that anyone can be physically active. Now, you might be sat there asking yourself, well, how can I be? I don't want to go to a gym, or I've never been to a gym before, or I can't afford to go to a gym. I don't want to go to another sports club, or whatever it is. There's always something that you can find to do. At a very, very basic level, the easiest thing you can go and do is go for a walk. If you're able, go outside and go for a walk around outside for a little bit. Or if you want a very basic kind of, you could do some very basic exercise at home. There's a load of resources online, but like a really, really simple one that I did when I very, very first started working out. I'm talking back when I was like 14 years old and I started trying to do workouts in my room for the first time. I found this really basic one, which was, you do as many press ups as you can in one go, so without a rest. You do as many squats as you can in a go without a rest, and you do as many crunches as you can in one go without a rest. And then you multiply each of those numbers by 4, and then that's the target that you're working towards. So you don't necessarily have to multiply by 4, you can multiply by 3 or by 5 if you want to make it a bit harder. But doing that means that you're just setting yourself a bit of a goal, you're setting yourself a bit of a routine, and that's the number that you work towards. So for example, if you can do, say, 20 press ups, you multiply that number by 4, you've now got a goal of 80. So what you do is you're not trying to do 80 in one go, but you're trying to then just do a cumulative total of 80. So you might do 20 on your first go, you might then manage to do like another, say, 15, so you're up to 35. You might then do like another 10, so you're at 45, another 10, 55, another 5, 60, another 5, 65, etc., until you get to 80 push-ups. And you just do all 3 of those exercises once through, and that's it. It takes you like 20, 30 minutes to do it, and you've started something. And if those exercises are too difficult, make them easier for yourself. Do it, you could do squats and you could have a chair instead. So rather than doing a full squat all the way down, you could squat onto a chair, or you could do a half squat. If you can't push up as a full push-up, you can do it on the knees push-ups, or you can find a wall and you can do wall-assisted push-ups. If you can't do crunches, you could do standing marches. Whatever it is, just to get your body moving and to reconnect with your body, I think is so, so important. So I'm now going to ask you guys, please do go and try this. Have a go at that workout that I've just suggested, or let me know other workouts that are really good for you to do at home. And yeah, let me know what you think. Please drop a comment below. Please like, subscribe, reach out. I'd love to hear from you guys. Thank you so, so much for listening if you've got this far. Until next time, I'll see you then. Bye-bye.